Hi, everyone. I'm Elaine Quijano. It's good to be with you. Thanks for joining us. Pfizer has formally requested the FDA expand use of its COVID-19 booster shots for anyone 18 and older. Currently, a third dose has only been authorized for Americans 65 and older, or those who are at high risk for the virus. CBS News correspondent Nikki Battiste reports.
More than 25 million people have had a booster shot since the FDA authorized it for anyone who is at least 65, high risk, or who already received the Johnson & Johnson shot. And studies indicate a third dose could be critical, as mounting evidence shows efficacy wanes anywhere from 6 to 8 months after full vaccination. Children remain at high risk after 5 to 11-year-olds became eligible for the Pfizer shot late last week. New data shows more than 100,000 children tested positive for COVID for the 13th straight week. More than 350 children have died of COVID since the beginning of September, bringing the total to nearly 900 child deaths since the start of the pandemic. In New York City today, these parents jumped at the chance to get the first vaccine dose for their children.
It's very significant. We just want our daughter to be protected.
10-year-old Leah Adams waited with her parents in one of the many lines wrapping around New York City blocks. Demand is outpacing supply at some schools and pediatricians' offices.
I want the vaccine.
Like many of the kids waiting, Will Hahn was hesitant but ready.
On a scale of 1 to 10, how excited are you to get the vaccine?
A 9 because I'm kind of nervous, but I really want to get it.
Several parents here at this New York City elementary school told me today they waited for nearly 4 hours to get their child a vaccine dose. But experts say if kids keep lining up for a shot, classrooms could be mask-free early next year. Elaine?
Nikki Battiste, thank you. For more, I want to bring in Dr. Angela Myers. She is the director of the Infectious Diseases Division at Children's Mercy Kansas City in Missouri. Dr. Myers, welcome. Thanks very much for being with us. I want to first ask you about Pfizer's request to expand its booster shots. The Biden administration received some pushback earlier this year for announcing plans to make those shots available to all adults. Critics said there was little evidence that younger, healthy people needed the extra protection. What does the science say now?
You know, it's interesting. The FDA or Pfizer submitted data to the FDA of a new study with 10,000 people looking at breakthrough infections in those that got the booster versus those that did not. And so it'll be great to see that data when it is made public and not just with the FDA. And I think that's what they'll be using to make their decision on expanding boosters for all adults.
Well, it has been 1 week since Pfizer's COVID-19 shot for children got the green light from officials. How has the rollout been so far at Children's Mercy?
The rollout has really been great here. We have given, close to 800 shots in children. We are giving vaccines every single day. We started last Saturday with a big mass vaccination clinic with 600 kids, and we have 600 kids scheduled for this coming Saturday and the Saturday after that. And then we were also giving shots every weekday as well.
That's great to hear. But many parents are anxiously trying to secure appointments for their children. Are there any concerns that supply will be able to meet the high demand?
Well, we've been reassured by the federal government that they have plenty of supply. It's maybe taking a little bit longer to get to the states and then from the states outward than folks would like. And so I think we will continue to get more shipments every week, and we will be able to get those kids vaccinated very soon. There's a little bit of a delay, I think, in the shipment process, just like there was initially when we first rolled out vaccine last winter.
Well, some school districts across the country require masks for students and staff. Now that children are eligible for vaccination, do you think, Doctor, that districts will be able to loosen or even perhaps do away with these rules in the near future?
Some school districts are planning to do that after the Thanksgiving break. But I will say this. We know that only about half of adolescents or teenagers are vaccinated, fully vaccinated against COVID-19. And so I would be really cautious on peeling away those mask mandates too soon, because we really need to have the overwhelming majority of people vaccinated in order to really be safe and really stop that transmission.
Yeah, and finally, Doctor, colder temperatures are beginning to push more people and gatherings inside where the virus can spread more easily. What is your advice for keeping new cases down as we enter the winter months?
Well, first and foremost, get vaccinated if you aren't already. And hopefully that your family members are, and you can spend your holidays in a safe environment with vaccinated family members. But I've had a number of people ask me what to do when they have family members who aren't vaccinated. And there are still obviously things you can do. When it's too cold to be outside and you have to be indoors, you can distance yourself while eating, you can wear masks. I know that that's not as much fun, but it's the best way to stay protected and prevent spread of disease when you have a mix of people who are unvaccinated and vaccinated.
All right, really important information. Dr. Angela Myers. Doctor, thanks very much.
Thank you.